Good afternoon, ladies and gentlemen. Welcome back with me with Yudion Putra in 12 a.m. News. In today's news, we have the COVID-19 update around the capital city in Jakarta, and we have the COVID-19 update around the world. It is indeed a battle that we can hardly win. Even though the enforcement of large-scale social restriction or PSBB has been far from expectation, the government and local administration has marched into reopening public places to prevent further economic losses. And that is proving to be a failure, even for Jakarta, which had been successfully curbed down the transmission of virus for weeks. The capital's dense population and poor implementation of health protocol have become major hurdles for the reopening.
Jakarta, which had been the hardest hit by the outbreak, managed to slow the virus reproduction rate, leading to its decision last month to gradually reopen offices and business centers. But a surge in cases over the past few weeks has shown that the capital has yet to get a grip on the virus, and crowds caused by the reopening may have contributed to the infection spike. As of Monday, Jakarta has recorded 14,797 cases with 697 deaths and 9,408 recoveries, making it the hardest hit province after East Java. Governor Anies Baswedan said the share of people testing positive have doubled to 10.5% of the total number of people tested. The largest clusters come from hospital, which accounted for about 45% of the cases, followed by local communities at 38%, while the rest came from traditional markets, migrant workers, and offices. The significant rise in local communities has been discovered because the public health centers have upped testing in residential areas, including the densely populated villages. Many of those who tested positive did not show any symptoms and would not have known about their status had the health official not come to them. But the mass testing does not adequately explain Jakarta's drastic surge in infections. Unlike the central government, Anies said the failure to practice physical distancing in public transportation and other public places was also to blame. He urged people to be cautious in public transportation and at traditional market to heed the health protocol by wearing face masks, keeping a distance from others, and frequently washing one's hand with soap. If virus transmission remains difficult to control, reinstatement of PSBB is a logical option. In a country with the fourth largest population worldwide, crowds are a major problem in the transition to the so-called new normal. Several countries with large population are failing to strictly implement the health protocol. Records from Johns Hopkins University show that the United States, by the third most crowded country, is now the nation most battered by the coronavirus, with 3.3 million cases and 135,000 deaths. Brazil, the seventh most crowded country, has taken the second hardest blow with 1.8 million cases and 72,000 deaths. India, the second most crowded nation, is in the third spot with 878,000 cases and 23,000 deaths. It is very easy to blame people for not following health protocol, but it is best that governments, including in Indonesia, improve access to health and safety measures for people who may neglect the protocol. It is best to never take for granted that people can take care of themselves or the notion of herd immunity. This is going to be a long journey and none of us know how it ends. The best way to come out of this pandemic is that we must implement a healthy lifestyle like do a routine workout, eat healthy food, wash your hands frequently, avoid crowded places in public, and the most important thing to do is to wear masks to minimize the risk of getting infected by the COVID-19.
That's it for today's news. We'll be back in 4 p.m. news. Thank you for watching. See you later and goodbye.